Welcome to Senior Sessions. I am your host, Dr. Denbow-Burke. While normal aging brings physical changes as well as illnesses that can influence physical activity, many older adults can still remain sexually active. In this episode, we will discuss common myths and barriers to sex in older adults and ways to improve your sexual health as you age. There are many myths and stereotypes about sex in older adults. Some common myths include: older persons don't have sex. The frequency of sexual activity decreases significantly with age. However, this doesn't mean that there is no engagement in sex. Sexuality in older life is undignified. In many societies, persons are inclined to desexualize older adults. The reality is that it is healthy for older persons to express their sexuality just as younger persons. Older persons are not interested in sex. Your personality never changes. So if you enjoyed sex in your younger life, your desire will not change as you age. Many older persons experience dissatisfaction and may even become frustrated when sex is no longer part of their life. His or her equipment doesn't work. Older men may experience issues with attaining or maintaining an erection. However, in this modern era, this can be alleviated by use of conventional or traditional therapies. On the other hand, women may experience difficulty with lubrication due to hormonal changes. This can be easily remedied by use of various external lubricants. Surgery in older adults makes them unable to have sex. As we age, we may find ourselves with illnesses that may cause us to have surgery on parts of our sexual anatomy, such as removal of the prostate in men and removal of the uterus in women. This in no way is an impediment to having normal sexual intercourse. Older persons do not have to worry about contracting sexually transmitted infections. Unprotected sex increases everybody's risk of HIV, and the number of older people with HIV is growing. So protect yourself and play it safe. Some common barriers to sex in older adults include personal barriers, such as lack or loss of a partner. For example, many older women are widowed. Living arrangements. Some older persons live with their family, children, or caregiver, and even in nursing homes. So there is limited privacy and capacity to be intimate with another person. Cultural or societal barriers. Sometimes, older persons who still have sex are portrayed in a negative light by facets of our society. Some ways to improve your sexual health include communication with your partner. Take time to understand the changes that your partner is experiencing and try to work to meet each other's needs. Sometimes, simple expressions of affection and intimacy, such as hugging, kissing, or touching, may be all your partner requires. However, if you don't have a partner, it is okay to take care of your own self. Don't be afraid to speak to your doctor if you have problems with your sex life. For older women, don't feel embarrassed asking for lubrication or moisturizers to help with vaginal dryness. And men, feel comfortable speaking about medications to help with erectile dysfunction as well as herbal supplements. Good hygiene. Shaving and keeping the genital area clean should be maintained even if you are not sexually active. Remember the power of the mind. You are as beautiful and sexy as you see yourself. Maintain a positive self-image despite the changes that occur in your body with age. In summary, there is no good age to stop living your best life. Thank you for your time. See you on the next episode of Senior Sessions.